how does a 15-minute lunchtime beauty treatment, something that's marketed as this simple, painless way to plump up the skin, how does that result in a fatal blockage of the lungs just 40 minutes later?
I mean, it's a stark, almost unbelievable contrast, right?
Yeah, exactly. You walk into a clinic expecting this quick confidence boost, and you end up at the center of a total medical catastrophe.
Right. And today, we're looking into a booming, highly lucrative trend in the cosmetic industry that is unfortunately turning that nightmare into a reality for some patients.
We're exploring the world of intimate aesthetics, specifically a procedure commonly known as labia puffing or labial fillers.
And, the gap between how this procedure is sold to the public and the actual biological consequences playing up beneath the surface is it's massive.
It really is.
Clinics package this as a routine touch-up, borrowing the casual language we use for facial treatments. But when we look at the clinical data, the story shifts from, aesthetic enhancement to a really profound medical warning.
Yeah, so we spent the last week digging through a huge stack of sources for you. We're talking about cosmetic clinic websites, peer-reviewed medical case reports, and some incredibly harrowing legal medicine autopsies.
Which were not easy to read, by the way.
No, not at all. But our mission for this deep dive is to synthesize all of this data to answer one highly specific, highly critical question for you. Can labial fillers cause urinary or structural difficulties?
And answering that really requires us to strip away all the glossy marketing terminology.
Right.
We have to look at the cold, hard anatomical reality of what actually happens when you force foreign substances into one of the most highly specialized, heavily vascularized regions of the human body.
So to understand the risks, I think we first need to look at what the industry is actually promising.
Yeah, let's start there.
If you pull up the clinical websites from our sources, they frame this as a solution to a very natural process. They note that as you move through different life stages, whether that's, simply aging, going through childbirth, experiencing significant weight fluctuations, or entering menopause, you can lose volume in the labia majora.
Which are the outer lips of the vulva, right?
Exactly.
And aesthetically, that volume loss can lead to wrinkling or sagging, which is obviously what the cosmetic side of the industry targets. But there is a functional argument they make as well.
Right, the padding argument.
Yes, the tissue there provides natural padding. And some clinics suggest that a loss of this padding can cause physical discomfort during everyday activities, like riding a bicycle, wearing tight clothing, or, during intercourse.
And the proposed solution for this is to inject dermal fillers directly into that tissue. According to the data, practitioners are mostly using hyaluronic acid, commonly known as HA.
Right, which people probably recognize.
Yeah, these are brands you might know from facial cosmetics, like Restylane or Juvederm. But they also use specialized intimate fillers marketed under names like Novia Rose and Deserial.
And in some cases, they even use a fat transfer.
Oh, right.
Yeah, taking adipose tissue from your own body and injecting it down there. And I mean, the marketed benefits are incredibly appealing. They promise more youthful appearance, better hydration to combat vaginal dryness, and a return to physical comfort.
The entire marketing strategy is built on normalization. They really want you to associate this procedure with something incredibly common, like getting a little filler to plump up your lips or smooth out your cheekbones.
Yeah, it's framed purely as volume restoration.
Reading through these brochures, the mental image that just keeps coming to mind for me is restuffing a couch cushion.
Well, that's a good way to put it.
Right, think about your favorite spot on the sofa. Over the years, the padding gets a little compressed and flat, so you unzip the cover, stuff in some fresh polyfill, and suddenly it looks pristine again.
It sits higher, the wrinkles in the fabric smooth out.
Exactly. And it gives you that soft cushioning against friction again.
And that is the exact psychological comfort the cosmetic industry is aiming for with that marketing. It sounds purely mechanical and, honestly, completely benign.
Right.
But the problem is that your body is not an inanimate piece of furniture. When you transition from a dead cushion to the living anatomy of the human reproductive system, the location of where you are putting that stuffing fundamentally alters the danger involved.
Okay, wait, I have to jump in here because I think a lot of people listening will have the exact same thought right now.
Sure.
Millions of people get hyaluronic acid injected into their faces every single year.
Absolutely.
It is one of the most common cosmetic procedures on the planet. So if the filler itself is safe for your cheeks or your lips, why is injecting it into the labia any different? I mean, isn't it essentially just skin and soft tissue?
I get why people think that, But treating the vulvovaginal area as just a simple canvas of skin is a really dangerous oversimplification
Okay, well,
because it is a highly specialized organ system. What separates it from your face and what introduces so much unseen risk is the underlying vascular architecture. The genital region is surrounded by an incredibly complex venous plexus.
a venous plexus. So we're talking about a massive tangled network of blood vessels.
Exactly. A dense, intricate web of veins and arteries that are responsible for the sexual response, tissue health, and regulating blood flow for the entire pelvic region.
Wow. Okay.
So let's discard the couch cushion analogy. Instead, imagine trying to pump a thick, viscous gel into a tightly packed electrical box.
Oh, that paints a different picture.
Right. The box is already full of essential fragile wiring. If you force too much gel into that confined space, the pressure has nowhere to go. It will eventually crush or sever the wires.
So the margin for error is essentially zero.
Pretty much, yeah.
You're introducing immense pressure and a foreign volume into a space that is already densely packed with a vital blood supply.
And that sheer physics problem leads directly to the structural difficulties we see in the clinical data.
Which brings us to a really specific, terrifying medical case report from our stack.
Yeah, this one is tough.
There's a documented case of a 47-year-old woman who went to a clinic for this exact procedure. She wanted labia majora and minora rejuvenation using HA fillers, but instead of a youthful aesthetic, she suffered a severe vascular occlusion.
Right, and a vascular occlusion means the filler entirely blocked her blood vessels, which halts the flow of oxygen and nutrients to the tissue.
And how does that actually happen during the injection?
Well, it happens in two ways. The practitioner either accidentally places the needle directly inside an artery and injects the thick gel, creating instant pluck.
Yikes.
Yeah. Or, more insidiously, they inject a massive volume of filler into the surrounding tissue, and the external pressure from that gel physically crushes the artery flat.
So either way, the blood just stops moving.
Exactly.
And the report notes that this didn't just result in a bad cosmetic look or like some bruising. It led to agonizing pain and what they diagnosed as necrotic skin ulceration.
And we need to be clear about that term. Necrosis is one of the most severe words you can encounter in a dermatological or surgical setting.
Because it literally means death, right?
Yes. The tissue is not just injured, it is biologically dying. It begins to rot away.
God, that's awful.
The very physical structure the patient was trying to enhance was being destroyed because its life support system, the blood supply, was completely cut off.
And to stop the tissue from dying completely, the medical intervention required was just staggering. They had to perform a super selective intra-arterial thrombolysis.
Which is a highly invasive rescue mission.
Right.
Medical teams have to thread a microcatheter into the vascular system, navigate it directly into the specific tiny artery that is blocked in the pelvic region, and then drip a dissolving agent directly onto the blockage to try and break up the filler.
And even after enduring all of that, the tissue was so damaged that she required specialized ongoing treatments with concentrated growth factors just to try and rebuild the necrotic wounds.
Yeah, it's a massive ordeal.
The contrast is just jarring. You go in for a quick beauty fix and you end up with a catheter inside your arteries trying to save your tissue from rotting.
And the fundamental takeaway here is that the structural integrity of the labia is entirely dependent on that rich, complex venous plexus. When you introduce thick fillers, especially misplaced or in high volumes, you are basically gambling with that blood supply.
But the danger doesn't stay isolated to the labia, does it? I mean, we're talking about the pelvic floor, which is a very crowded neighborhood, anatomically speaking.
Very crowded, yeah.
If you have severe structural swelling, tissue death, and massive inflammation, that pressure has to displace something. And right next door is an entirely different vital system, the urinary tract.
Right, and this connects directly to the core question of our deep dive. Can these fillers cause urinary difficulties?
And what do the sources say?
The clinical literature explains the mechanism really clearly. When severe swelling, intense inflammation, or a localized infection like an abscess develops in the labia, the sheer physical mass of that complication can press inward.
And it presses directly against the urethra.
Exactly. The tube that empties the bladder, it physically pinches it shut.
Oh, wow.
Yeah. And to understand the mechanics of this, the sources provide a parallel case study involving permanent PMMA fillers. These were used in a male patient for genital girth enhancement.
And PMMA, just to clarify, those are the permanent microscopic plastic spheres suspended in a gel, right?
Correct. So in that case, the practitioner injected a large volume of the filler deeply into the tissue. The body reacted with extreme obstructive swelling. The pressure was so intense it caused urethral bleeding and led to acute urinary retention.
Meaning a complete inability to urinate.
Exactly. Now, male and female pelvic anatomy are obviously different, but the fluid dynamics of injecting foreign volume into a confined genital space remain identical.
Right. Volume plus a confined space equals outward pressure.
Exactly.
And if you look at the amounts being injected in these female labial puffing procedures, it is shocking. Some clinics are injecting up to 15 milliliters of filler in a single session.
15 milliliters is an enormous volume for that specific anatomical area.
Right.
I mean, picture 3 full teaspoons of thick gel being forced into the delicate tissues of the vulva. The local pressure that creates is immense.
Wow.
And if the body mounts an inflammatory response, which it often does to a foreign substance, that swelling expands inward. It compresses the female urethra, leading to severe urinary difficulties.
So patients experience dysuria, which is incredibly painful urination.
Yes.
Or worse, the urethra is so compressed that the bladder just cannot fully empty. The urine just sits there trapped.
And that creates a breeding ground for bacteria, leading to a high risk of secondary severe urinary tract infections. You're basically creating a functional mechanical failure of the urinary system, entirely secondary to a cosmetic surface procedure.
Okay, so we've established 2 major life-altering consequences so far. You can suffer structural tissue death from crushed blood vessels, and you can suffer severe urinary obstruction from the swelling pinching the urethra shut. But as we dug deeper into the medical autopsies, we found a complication that makes both of those localized issues look almost mild in comparison.
Which is hard to even imagine.
It is, because when you introduce that much pressure into that specific venous plexus, the filler doesn't always stay in the pelvis.
Yeah, it doesn't. And this represents the absolute worst-case scenario. What happens when the structural pressure we have been discussing turns fatal?
Right.
For the answer to that, we have to examine the forensic autopsy reports published in the Korean Journal of Legal Medicine.
These reports are, honestly, they're difficult to read, but they are crucial for anyone considering this procedure. They detail the case of a 38-year-old woman who went to a clinic and received that massive 15-milliliter dose of HA filler injected into her vaginal wall.
A huge dose.
Yeah, and she left the clinic, and while on her way home, just 20 to 40 minutes later, she completely lost consciousness.
And the forensic autopsy mapped out exactly what happened, step by step. It all comes back to the physics of pressure in a confined, highly vascularized space. The local pressure from that huge 15-milliliter injection was so extraordinarily high that the thick HA gel couldn't just sit in the tissue. The pressure actively forced the gel backward, rupturing into her paravaginal veins.
So the filler literally broke into her bloodstream.
It did. The autopsy found that locally, the gel had spread extensively, even reaching her rectal mucosa. But systemically, the consequences were devastating.
Because it's in the veins now.
Exactly. Once that gel entered the paravaginal veins, it had a direct highway to the heart. It traveled up through the venous system, passed through the right side of her heart, and was blasted directly into her pulmonary circulation.
Her lungs. It went straight to her lungs.
Yes, she suffered a massive, fatal, non-thrombotic pulmonary embolism.
Let's break down that term, because a traditional pulmonary embolism is something people might be familiar with.
Right. Usually that's a blood clot that forms in the leg, breaks off, and gets stuck in the lungs, blocking the oxygen supply.
But the non-thrombotic part means this wasn't a blood clot at all.
Right. It was the actual cosmetic filler. The thick, viscous hyaluronic acid gel traveled through her veins and physically clogged the blood vessels in her lungs. The lungs could no longer oxygenate her blood.
That is just horrifying.
It is. And despite emergency medical intervention and being placed on advanced life support, the damage to her pulmonary system was too extensive. She passed away 10 days later.
And the journal doesn't treat this as an isolated freak accident either. They detail a second, even more terrifying case.
Yeah, the second case really drives the point home.
A 35-year-old woman received an injection of collagen and PLA filler for the exact same intimate rejuvenation purposes. The mechanism was the exact same.
Yeah.
The filler was forced into the venous plexus.
And she went into cardiac arrest just 4 minutes after the injection.
4 minutes.
4 minutes. The speed at which this happens highlights how intimately connected the local genital vasculature is to the central circulatory system.
It's not just a localized area.
Not at all. Direct intravascular injection, or filler migrating, simply because the local tissue pressure is too high. These are not theoretical risks. They are documented, fatal realities.
Think about the jarring disconnect here. You scroll through social media or a clinic's website, and they are selling labia puffing.
Which sounds so harmless.
It sounds cute. It sounds like a fun lunchtime beauty touch-up so you feel a little more confident in your yoga pants. Yet, anatomically, depending on exactly where that needle goes and how much pressure is applied, it has the potential to instantly stop your heart.
It completely dismantles the narrative that aesthetic interventions in functional organs are inherently safe.
Yeah.
The vulvovaginal region poses a massive, unique risk for dermal fillers entirely because of that dense underlying venous plexus. The cosmetic industry markets the visual result, but they cannot market away the anatomical danger.
So, synthesizing everything we have uncovered in these medical reports and autopsies, let's directly answer the mission question we established at the beginning of this deep dive. Can labial fillers cause urinary or structural difficulties?
And the answer from the clinical data is definitive, undeniable yes.
Right.
The biological reality is clear. While it's marketed as a simple volume restoration, the rich vascular network and the confined anatomy create a perfect storm for complications.
And it happens in multiple ways.
Exactly. Misplaced fillers, or high-volume injections, create localized pressure that can compress the urethra, causing severe urinary retention and infection.
Right.
That same pressure or misplaced needle can crush or block arteries, starving the tissue of oxygen and causing agonizing necrosis. And in the most tragic, severe cases, that filler can be forced into the venous system, migrating directly to the lungs with rapid, fatal consequences.
So why does all of this matter to you? Because the aesthetic industry is relentless. It is constantly evolving, constantly finding new insecurities to target, and constantly moving into new areas of the body.
Always looking for the next big trend.
Exactly. And whenever you encounter a new cosmetic trend, especially one that targets complex, highly functional organs, it is absolutely vital to look past the marketing gloss. Quick fixes rarely respect anatomical boundaries.
Understanding your own biology is your best, and sometimes only, defense against an industry that routinely minimizes medical risk in favor of aesthetic appeal.
Which leaves us with a final thought for you to ponder long after this deep dive ends.
Yeah, this is the part that really sticks with you.
If these cosmetic procedures carry biological risks as severe as urethral obstruction, rotting tissue, and fatal pulmonary embolisms, why are they so often performed in lightly regulated medi-spas by practitioners who aren't highly specialized urologists or gynecologists?
That is the real question.
What does it truly say about the modern pressure we feel to achieve aesthetic perfection, that we're willing to risk the vital, life-sustaining functions of our most hidden organs just to smooth out a few wrinkles?
It forces us to question the lengths we will go to for an aesthetic ideal, and more importantly, who we are trusting to take us there.
Exactly. Your body is not a deflated couch cushion waiting to be casually restuffed.
Yeah.
It's a brilliant, delicate, complex system. Treat it with the respect it deserves.